Deputy Commissioner General Support Service, S. Ndanga, Mr. Ndanga, Colonel B. Mahea, representing Brigadier General Mutetse, Director General Health Services, ZNA, all commissioners here present, Officer Commanding Harare Province being represented by Assistant Commissioner Mutimba Nyoka, Mr. N.S. Chikwekwete, District Public Works Officer representing Public Works, Chief Director Health Services, ZRP being represented by Chief Superintendent Chikoto. I think I also saw Chief Director of Health of the City of Harare. Thank you very much for coming. Senior officers and all officers here present, the community and media fraternity. It is with great pleasure and profound gratitude that I extend a warm welcome to each and every one of you gathered here today for the commissioning and official opening of this Center of Excellence at Chikurubi Prison Complex. This complex will instill hope and confidence in the well-being of the residents of the Chikurubi community. This occasion marks a significant milestone, one that we have eagerly awaited and tirelessly worked towards. Ladies and gentlemen, allow me to commence by referring to an Arabic proverb famously quoted by the 19th century British philosopher Thomas Cayley. And I quote, "For he who has health has hope. He who has hope has everything." End of quote. This commissioning not only signifies the completion of a project, but also symbolizes our commitment to progress, growth, and excellence. It reflects our unwavering dedication to servicing our community, advancing technology, and shaping a bright future for this community. In this light, we extend our deepest appreciation to the AIDS Health Foundation for their generous contribution to the establishment of this invaluable facility. It is with immense pleasure that I welcome each of you to this significant gathering. I would like to offer a special welcome to our esteemed guest of honor, the Honorable Minister of Health and Child Care, Dr. Douglas Mombeshora. Your presence, Honorable Minister, lends great significance to this event, and we are truly grateful for your attendance. We know that you have left your other commitments which could have been more pressing, but you chose to join us at Chikurubi. We would like to thank you. We are also honored by the presence of the Honorable Minister of Local Government and Public Works as represented, who oversees all government buildings and structure. Your support and presence here today to officially commission this building are deeply appreciated. Your support has been instrumental in our efforts to enhance infrastructure development in our correctional institutions for the benefit of all. Ladies and gentlemen, special recognition is also extended to the Ministry of Health and Child Care, the Ministry of Local Government and Public Works. Your presence here underscores the importance of this occasion, and we thank you for joining us. Allow me, ladies and gentlemen, to extend a warm welcome to Dr. E. Chati, the AHF Country Director, and all officials from AHF who have contributed to making this day possible. Your assistance and partnership is invaluable. We have toured the facility and we saw the great works that AHF that AHF did, and we are grateful. I also welcome the various stakeholders working with the Ministry of Health and Child Care, as well as all our esteemed invited guests. Your presence enhances the significance of this memorable event. Ladies and gentlemen, the government of Zimbabwe is steadfast in its commitment to providing quality health services as enshrined in the Constitution, which recognizes health as a fundamental human right for all. Improved health not only leads to greater happiness and well-being, but also drive economic progress. A healthy nation prospers better than an opposite of that. This facility will undoubtedly benefit the Chikurubi prison and surrounding communities, contributing to the health and productivity of our citizens. Ladies and gentlemen, once again, I welcome you all to this momentous occasion and thank you for being part of this incredible journey. Here is to the success of this commissioning and official opening ceremony of this Center of Excellence at Chikurubi Prison Complex, and to the future that lies ahead. God bless you all. I thank you.
Thank you, Madam. As I invite Dr. Chati to come and give his remarks, ladies and gentlemen, Tashika Pananditika, and everyone is looking healthy. And I will tell you why are you looking healthy today.
Thank you. Thank you, Director of Ceremonies, Honorable Minister of Health and Child Care, Dr. Douglas Mombeshora, Permanent Secretary of Justice, Legal and Parliamentary Affairs, Mrs. Nyemba, Permanent Secretary of Health and Child Care, Dr. Aspect Maunganize, Commissioner General of the Zimbabwe Prisons and Correctional Services, Commissioner General Chiovu, Deputy Commissioner General Production and Business Management, S. Mpofu, Deputy Commissioner General Operations, MC Manivi, Deputy Commissioner General Support Services, S. Ndanga, Colonel Mahea, representing Brigadier General Mutese, who is the Director General of Health Services at Zimbabwe National Army. All commissioners here present. I also recognize the presence of Dr. Chons, City Health Director, and also Dr. Mugurungi, Director of AIDS and TB Unit. Officer Commanding Harare Province being present here, represented here by Assistant Commissioner Mutimba Nyoka, Mrs. N.S. Chikwekwete, District Public Works Officer representing the Public Works, City Director of Health for ZRP, represented here by Chief Chikoto, senior officers and all officers here present. The community and media fraternity are also recognized, the senior management from AIDS Healthcare Foundation. It is my pleasure to be part of this distinguished event where AHF Zimbabwe is showcasing its partnership with the government of Zimbabwe to take steps in the country's quest to attain key goals of providing quality service to all the citizens. Guests of honor, sir, distinguished ladies and gentlemen, looking at Zimbabwe's Vision 2030 and related key policies, the government of Zimbabwe has shown commitment to provision of efficient, integrated and quality healthcare services to the citizens of the country. In today's event, AHF continues to show commitment to contributing to these key national goals by supporting selected sites through infrastructure development, technical support and human resources. These are key components of our organization's strategy. Only last year, Honorable Minister said, there is a building at Gweru, Center of Excellence, which was officially opened, again supported by AHF. And today, we are witnessing another new site being completed here at Chikurubi Maximum Prison. Honorable Minister said, distinguished ladies and gentlemen, as an organization, our mission is to provide cutting-edge medicine irrespective of ability to pay. Hence, on the science we support, we want clients to be provided excellent service in a comfortable environment. Our organization has aligned this program to feed into Zimbabwe National Health Strategy, which aims to improving the health and well-being of the population. And also we are feeding into the Zimbabwe National AIDS and HIV and AIDS Strategic Plan, ZNAPS 4, key to it being ending AIDS as a public health threat by 2030. But who is AHF? I think you might want to know. This is the first time some of you are seeing us. Who are we? Allow me just to briefly tell you about our organization. AHF is a global not-for-profit organization started in 1987 by our founding president, who is still there, called Michael Winston. He started this organization in Los Angeles in the United States. What happened during that time, 1987, I'm sure Dr. Jones and Dr. Mugurungi will remember this. That time there were no medicine, there were no ARVs, they were not readily available. So when our president was walking in Los Angeles, he saw some people dying, practically dying in the streets, with no dignified burial. No one wanted to touch them. There was a lot of stigma associated with HIV. So he started an organization, hospice services for those people dying in the streets. He took them into his own house, started taking care of them so that they die a dignified death. When the medicine were introduced, he started getting his own resources to pay for those clients who were dying of HIV. So this is our core value. This is who we are as AHF. So since the inception, 1987, we've gone to more than 45 countries. Our program, it might interest you, Honorable Minister, to know that AHF was one of the first organizations actually to start people on ARVs in South Africa around 2001. So this shows the commitment of AHF. AHF, when you come in the country, we are here to stay. We come and partner the people of Zimbabwe and support them throughout. Honorable Minister, distinguished ladies and gentlemen, in Zimbabwe, AHF started operating in 2016. We signed an MOU with your ministry, Honorable Minister. And in that MOU, the ministry requested AHF to help it establish what we call centers of excellence in HIV care and treatment. Currently, we are present in Harare, Bulawayo, Mutare, Gwanda, Gweru, and Masvingo. In all, AHF has supported infrastructure development to the tune of close to $1 million so far from 2016. As AHF, we will continue to expand our program to other selected sites and be an effective partner of the government of Zimbabwe in the health sector. And this year, we will plan to expand our support to Chinhoyi Provincial Hospital, Marondera Provincial Hospital, and also to ZPCS Family Kami Prison OI Clinic. Turning to Chikurubi, Honorable Minister, sir, AHF support for Chikurubi began initially, the initial conduct was sometime in 2019. We came as a visit. We're part of partners with National AIDS Council, and there was a call to help Chikurubi, and we listened to that call. So this is how it came about. We came, did an initial assessment of the facility, and one key gap which was identified from that assessment was lack of space for our clients to be treated. So we motivated to our head office. They usually listen. If it pertains the patient, they usually listen. So we motivated for resources to build the structure you're seeing today. So from the second half of 2021, AHF has been supporting the prison OI clinic with, among other things, medical supplies, lab supplies, selected pharmaceuticals, equipment, such as office furniture. There's also been a component of training for healthcare providers who are for Zimbabwe prison correctional services. AHF has also supported health PA educator sessions with inmates at Chikurubi, and also provision of sanitary wear to female prisoners at Chikurubi and Shurubi, that is Wawa. Honorable Minister, guests, distinguished guests, ladies and gentlemen, due to the gap of office space, which was identified, like I said, we requested for some resources. I just need to mention here, the construction of this facility is not about AHF. I really need to appreciate Zimbabwe prison and correctional services, the support you gave us. We didn't use much resources. When I'm giving reports, this facility, the cost of building this facility, we used about 50 to 60% of the costs. Then you want to ask, what about the rest? The rest came from them. So this is a partnership. It's not AHF providing everything, it's a partnership. And we hope this partnership will continue, Honorable Minister said. Honorable Minister, in conclusion, I would like to conclude by thanking the esteemed guest of honor, Honorable Minister, for gracing this occasion. It shows the government commitment to quality and also shows that you value our partnership. So we really want to thank you, Honorable Minister. I would like to commend the work being done by the government of Zimbabwe in different ministries and the security sector. I would like to also thank the Zimbabwe Prison and Correctional Services and the AHF Zimbabwe team for working so hard for this project to be completed. I would also want to thank the Ministry of Health Structures. Also want to thank the Minister and Permanent Secretary and the staff at the site level for the cooperation to allow the completion of this structure. I also want to thank other key government departments who work with our teams, especially Public Works. They were very supportive as well. I would like to finally commend the organization contracted to design and assist in the construction of the new building for work well done. May our relationship between ourselves and the government of Zimbabwe continue to flourish, as our program is a long-term program, like I said. May we continue to see more key milestones in the future. Once again, I thank you, everyone here present, and may the country continue to be blessed and succeed. Thank you.
Dr. Chati, thank you very much for coming on board to partner with the ZPCS. Right, ladies and gentlemen, allow me to invite Dr. Maunganidze to come and tell us who is the Minister of Health and Child Care. We've been struggling to get the answer. So, there you are now.
Thank you very much, Director of Ceremonies. Honorable Minister of Health and Child Care, Dr. Douglas Mombeshora, my colleague, Permanent Secretary for Justice, Legal and Parliamentary Affairs, Ms. Nyemba, Commissioner General of the Zimbabwe Prisons and Correctional Services, Vachiwovu. Allow me to write on protocol that has already been observed and proceed to introduce my boss, who has told me many times that he feels very uncomfortable when I take the podium to introduce him. But today I will not make it harsh. My boss is someone who is well known to most of you. Honorable Mombeshora is a medical doctor by training, a senior medical doctor in the profession, having graduated at the 10 as we're getting soon after independence, to be attested in the Zimbabwe National Army and rise to retirement in 1991 as a colonel, and gone into private practice, gone into community mobilization in his, especially in Mashonaland West, gone into activities to uplift those of poor social circumstances, and fully active in Red Cross activities, International AIDS Society, gone on to do urology. So he's really a man of many talents and a farmer who I think most of those who are involved in livestock farming must have gotten a bull or two from his farm. He is a man who believes in open door policy, which is a phenomenon he has taken into our ministry, and all of us have had to do the same. It's an honor for me to ask our Honorable Minister, our guest of honor today, to give his remarks. Allow me, Honorable Minister, to ask you to give us these remarks. Thank you.
Foundation tichangopedzera chingwati AHF vakaita basa guru pano. At this juncture, let me also recognize Dr. Prosper Chonzi, the Chief Medical Officer of Health for Harare, Deputy Commissioner General Production and Business Management S. Mpofu, Deputy Commissioner General Operations MC Maniri, Deputy Commissioner General Support Services S. Ndanga, Colonel B. Mahea, representing Brigadier General Matete, who is the Director General of Health Services in the Zimbabwe National Army. All commissioners here present, Officer Commanding Harare Province, represented by Assistant Commissioner Mtimba Nyoka, Chief Director, Health Services ZRP, being represented by Chief Superintendent Chikoto, all senior officers here present, members of the press, ladies and gentlemen. Pamberi neutano, pasine nyope, nyope tisingadi kuvaka zvipatara. Aiwa hapana nyope handiti. Taona kuti basa riri pano rakabatwa pamwe chete, pakaitwa mushandira pamwe chete zvikabudirira. I am honored to officiate this significant event here at Chikurubi Maximum Prison Complex, as we are gathered for the official opening of a Center of Excellence, courtesy of the benevolence of AIDS Healthcare Foundation, AHF. May I from the onset highlight that investing in health infrastructure is a direct investment in the socio-economic progression of our communities and the country at large. Hence, the setting up of this vital establishment is a welcome development to the constituencies of Chikurubi Prison Complex and surrounding community. Ladies and gentlemen, health is a fundamental human right as enshrined in our Constitution of Zimbabwe. Hence, the kind gesture by AIDS Healthcare Foundation, whose remarkable collaboration with the government of Zimbabwe through the Zimbabwe Prisons and Correctional Services shall forever be cherished. Indeed, this is in line with the government's thrust towards developing and improving the health delivery system for its citizens. Through the able leadership of our visionary President of the Republic of Zimbabwe, His Excellency Comrade Dr. E.D. Mnangagwa, we are destined for a healthy and prosperous nation as we pursue Vision 2030. Leaving no one and no place behind is the President's mantra that entails that development should be prevalent in every sector, with the health sphere not being an exception. As we reflect on the government's Vision 2030, which aims to transform Zimbabwe into an upper middle income country by 2030 through the National Development Strategy NDS1, it becomes evident that social development pillars signifies the government's unwavering dedication to establishing an efficient, integrated, and high-quality healthcare system in Zimbabwe. Notably, in these national policies, the government has recognized the significance of good health to all. To this end, as government,
We would like to commend partners such as AHF and other related international and local organizations that have shown commitment to contribute towards achievement of key national goals by supporting the health sector through medical and technical provisions, infrastructure development, and capacitation of human resources. Henceforth, we applaud AHF for aligning its programs to feed into our national health strategy, which aims to improve the health and well-being of the population, and the Zimbabwe National HIV and AIDS Strategic Plan 2021 to 2025, which is ZNAPS 4, which seeks to accelerate progress towards ending AIDS as a public health threat by 2030 through guiding HIV programs, resource allocation, and implementation of the HIV response. Distinguished guests, I am reliably informed that AHF is currently providing medical care and treatment services in 45 countries worldwide, with 13 of these countries located in Africa. Among these African nations are Zimbabwe's neighboring countries, namely South Africa, Mozambique, Malawi, and Zambia. In Zimbabwe, AHF began its operations in September 2016 after signing a memorandum of understanding with the Ministry of Health and Child Care. One of the key objectives outlined in the partnership is the transformation of OI clinics at central and provincial hospitals into centers of excellence for HIV treatment and care. AFH has managed to deliver on its mandate, with centers of excellence being set up at Parinyatwa, Mpilo, Salim Gabe, and Gweru hospitals, while extending its assistance to many provincial and central hospitals and clinics. It is imperative to note that the involvement of AHF Zimbabwe in correctional institutions, and to be in particular here at the Chikurubi Maximum Prison OI Clinic, is commendable. I understand AHF Zimbabwe is also intending to offer further assistance at Kami Prison Complex after a needs assessment has been conducted. This goes on well with the government's standpoint on leaving no one and no place behind. Thus, today, we are witnessing the commissioning of a new OI clinic here at Chikurubi Maximum Complex. This comes with equipment provided by AFH. I am therefore delighted to stand here today and witness the positive outcomes of a successful partnership that has been cultured between ZPCS, the Ministry of Health and Child Care, and AHF Zimbabwe. It is our sincere hope that the entire Chikurubi prison complex community will benefit from the services provided by this facility, which I am told shall not only be restricted to HIV and AIDS issues, but to all health-related aspects. Whilst we celebrate this establishment, let us not forget those incarcerated in facilities at this complex. It is gratifying to note that inmates were directly involved in the construction of this facility, which corroborates well with ZPCS thrust of rehabilitating offenders. Participation by inmates in such construction projects is praiseworthy, as it provides and enhances their skills that usher opportunities for gainful employment after release from prison, hence desisting from further commission of crimes. In this regard, the department would have fulfilled its constitutional mandate of protecting the society through the rehabilitation of offenders and their successful integration back into communities where they are expected to live as productive and law-abiding citizens upon completion of their sentences. Having said that, I would like to once again extend our utmost appreciation to AHF for their involvement in capacitating health facilities in Zimbabwe. May I encourage other like-minded organizations to continue expanding and advancing their support to the Second Republic's endeavor to improve the living standards of our citizens. Together, we will guarantee the provision of quality health care to our communities. With these remarks, may I declare this Center of Excellence officially opened. I thank you.
Tinotenda ngatiroyemo zvekare guest of honor.
Sithabile kakhulu ngeklinikhi efakwe lapha eduze ngoba abantu abaningi bebethi bangagula ebusuku i-transport and so forth kube kuhlupha ukuthi umuntu ethwale ehanjiswe esibhedlela. So at least nxa sekulesibhedlela lapha eduze siyathaba. Abanye bakhona babe belezisu andilakwazi ama-complications womuntu olesisu. Ube sithengeza ubuhlungu ebusuku kuswelakala ukuthi i-help yokuthi yenze njani. So then iklinikhi le lapha incedile kakhulu. Sithabile sibongile.
Inini ndoitwa Mai Christian Tsinamodzi semugari wemuchikurubi. Toda kutenda nechipatara chatavakirwa icho chinoita kuti hatichazokwanise kuenda kure sekutauni ndokwataenda tikange tashaya mishonga. So toda kutenda Minister of Health navachihovhu vaita kuti tione zuva ranhasi nechipatara chedu. Toda kutenda
isusu secommunity tiri kutenda zvikuru nevakativakira chipatara ichochichi. Tiri kuvatenda chokwadi nekuti vakatitira chinhu chakanaka secommunity.
Retwa Tawanda Mutegedza. Totenda ne-D clinic yavakwa panzvimbo ino yeChikurubi maximum prison. Tinotenda nekuti tawana utano, tawana chipatara chiri padhuze mucommunity yatiri gere ino yeChikurubi maximum prison.
We are very grateful as the Chikurubi maximum complex dependents because we are no longer traveling from here to Parere Nyachwa because the facility can now accommodate even for some admissions to the patients, and we are also grateful because our old clinic was very small to accommodate many patients. So we are very grateful, and I would like to thank the Zimbabwe Prisons and Correctional Service for the support in supporting us in terms of health. Because, for example, I'm a chronic patient. It is very useful to us, and we are being helped so much. We are very thankful to the Zimbabwe Prisons.